Hi, in this video, I'm going to be talking about side effects or other complications that can slow down your treatment. And I'm going to focus first on chemotherapy. If part of your treatment plan includes chemotherapy, and you can find out more about this if you visit Yerbba.com to see if chemotherapy will be part of your treatment plan. If you're on chemotherapy, there are several things that we watch out for. The first is, how are you tolerating it? So in particular, how's your nausea? Are you having any vomiting? If you are, we would make adjustments to the medicines that we give you before chemotherapy or after the first cycle, before the second cycle, to make it more tolerable for you. It's very uncommon to have to hold chemotherapy or reduce the doses for nausea or vomiting. Another thing that we check for before you get your next chemotherapy are your blood counts. And if your blood counts, particularly your white cell count, and particularly something called the neutrophil count, those are the cells that fight bacterial infections, if those are low and too low, you won't get your chemotherapy that day, but you'll probably get it a week later. One thing that a lot of people do is they get their blood counts checked the afternoon before, especially if you live far away from where you get your chemotherapy, and you'll find out before you drive all that way if your counts are good enough. You don't want to have it done too late in the day because then the results won't be back for your medical oncology team. If your counts are continually staying low, or if they're so low you get an infection, we lower the doses of chemotherapy just a little bit. This does not reduce their effectiveness. I'll explain why. Your body is seeing a bigger dose, what we call the effective dose in your body, is actually higher than in somebody whose counts don't go low at all. So the way you metabolize the drugs is such that they hang around longer and your body's more sensitive to them. And that also means the cancer cells are seeing higher levels of chemotherapy. So don't worry if your chemotherapy doses have to be lowered a little bit because of problems with your blood counts. Anemia, which is lower red cell counts, is pretty uncommon early on in chemotherapy, but we can see that later on, especially with some chemotherapy regimens or combinations. If you want to learn more about the combinations you might be getting or that are part of your treatment plan, go to www.yerbba.com. So if you get anemia and it's over time getting worse, sometimes we have to hold the chemotherapy and we'll actually offer a transfusion. That's primarily if you're older or if you're having symptoms like fatigue or shortness of breath. Younger people can tolerate a lower red cell count than older people. Now that would be the opposite if you're younger and you're very active and you're really symptomatic. We might offer you a blood transfusion. We'll cover blood transfusions and their safety in a later video. So platelet counts, that's the other type of cell count that can be decreased with chemotherapy. Platelets help us clot, and if we see that the platelets are low, we don't want to increase your risk of bleeding, so we might hold the chemotherapy at that time, or we might lower the dose a little bit. Again, don't worry if the doses have to be lowered, and you can always ask your doctor for assurance about this, but we basically are titrating the medicine to what your body can tolerate. There aren't a lot of drugs used in the treatment of breast cancer that lower platelets, but there are in other cancers. So if you have another kind of cancer and you're wondering about this, we do keep a close eye on your platelets. Before you get your next chemo, you'll have a complete blood count, the CBC, and that's what shows you your white cells, red cells, and platelets. All right, the other side effects or things that can arise when you're getting chemotherapy that might alter your chemotherapy timing or the dose would be if you were to have irritation of the liver. Our livers are amazing. They're responsible for getting rid of chemotherapy once it's no longer needed. So all the breakdown products of chemotherapy are cleared by the liver. Sometimes the liver can get a little bit irritated. It doesn't matter whether you have a normal liver to start with, but sometimes we'll see some elevation of tests that are often called liver function tests, but they don't really interfere with the function of the liver. They're more showing you a little bit of irritation, or yeah, that's probably the best word, irritation of the liver. And sometimes we'll have to hold your chemotherapy doses till those get better, or lower the doses. It may also be the case that you start chemotherapy with some irritation of the liver, and this should be evaluated. We should see why that's the case. Do you have another problem causing hepatitis, which can be viral, it can be chemical from other meds you're on, it can be because you have what's called a fatty liver. But then we will do an evaluation of your liver before we start chemotherapy in most cases. You don't have to have your liver test checked every single chemotherapy time, but I usually do it after the first cycle just to make sure you're tolerating it okay. There's some chemotherapy that can elevate the bilirubin, which is the chemical in your blood that makes people turn yellow. If this gets high enough that you're actually showing some signs of yellowing of the whites of the eyes or the mucous membranes of the mouth, we will stop the drug till your liver is normal, till the bilirubin is normal, and then resume, usually at a lower dose. There is quite a bit of tolerance in the bilirubin, and there's one drug where we just know the bilirubin's going to bounce around, and we'll continue with the same drug at the same dose, continuing to follow you, of course. Okay, so we've covered nausea and vomiting, complete blood count. We've covered your liver being irritated. I'm just going to say very rarely does chemotherapy bother the kidneys, so I'll just pass that one by. The other is if you have a lot of aches and pains or fatigue. So these we call constitutional symptoms. They're kind of affecting your whole body. And what you'll want to do is talk with your medical team really honestly about how you're doing. Sometimes if people just feel terrible when they're getting chemotherapy, we'll actually make a change to a different regimen. That's not that uncommon. Don't worry. We see this in about maybe up to 30% of people treated not on a clinical trial. So in usual practice, we can see changing of what's called the regimen to another regimen. You won't be switched to an inferior regimen. We'll just pick one that your body hasn't seen to see if you tolerate it better. With most side effects of chemotherapy, they can become more severe with the further cycles. So fatigue can become worse. I mentioned anemia can become worse. And there's another side effect that I'll end with, and that is neuropathy. We've covered this in another video, but neuropathy is when you get numbness, and I'm holding my fingertips like this because it's usually in the fingers and the toes. If you have neuropathy and numbness or pain that's not better by the time you're getting your next dose, you have to tell your medical team because this can become permanent. And it's actually one of the most common reasons that we will stop chemotherapy early. It does not appear that there's a major compromise in your outcome. In other words, if you get enough symptoms that you're having painful fingertips, numbness of your fingers and toes, then it's probably the case, as with other side effects, that your body is seeing basically a higher dose because of the way you get rid of the drug. Nothing wrong with your body. It means you may not need as much as somebody who flies through with no side effects. Now, this is not to say if you fly through with no side effects, the chemo isn't working. So those are the main reasons that we would make a change in your chemotherapy itself. There are a few other side effects that can come up that will change what we give you to help tolerate those side effects. But I really wanted to address those things that arise that would make us consider a change in how often we give it, the dose, or even the particular recipe or regimen that you're getting. Don't forget to visit Yerbba.com to learn more about your specific treatment plan that you might be offered by your medical team. And if you like this video, click like and subscribe. What that does is it helps other people or their families who are learning about breast cancer find this particular video.